Good evening. I'm going to make a start at 6 o'clock. I'm going to go through some housekeeping rules. Good evening. Thank you all for attending this meeting of the Social Care and Health Overview and Scrutiny Committee. The committee is meeting this evening in person in the town hall with appropriate social distancing requirements. It will be conducted by the hybrid meeting system to enable it to be streamed on YouTube and to enable officers to contribute remotely if required. The meeting this evening will be recorded and uploaded to the YouTube by end of tomorrow. Voting this evening will be the way of show of hands. I will report if the vote was being carried, and this will be recorded within the minutes. The agenda and reports for this meeting are available on the council website. To proceed and confirm we have a quorum, I will introduce myself and call each committee member in attendance one by one to introduce themselves and to confirm that they can see and hear the proceedings. So, Councillor Hussain, I can see and hear. Councillor Sears, can you see and hear? Yeah. Councillor Ditta, she's here, but she's gone outside. Okay. Councillor Gandham, thank you. Councillor Murphy,
I can see and hear.
thank you. Councillor Robinson's not here presently. Councillor Waters,
I can see and hear, Chair.
thank you. And we've got Councillor Cole.
Councillor for Oldham Central and South, I can see and hear, Chair. I'm in replacement of Councillor Joe Hell.
Thank you. We also got portfolio holder Councillor Craddock.
Yeah, I can see and hear quite clearly. Thank you.
Thank you, Councillor Craddock. And Councillor Pell is present in person.
Thank you very much. Good evening, Chair. Yes, I can clearly see and hear.
Brilliant. Thank you. I can confirm we have a quorum for this meeting. In attendance this meeting, to support this meeting, we have Professor David Loughton. Can you hear us and see us?
Good evening. Yes, I can see and hear you, Chairman. Thank you.
Thank you. Annie Marie Kanabi. Sorry. Okay, no problem. Lisa Carroll. No.
Yes, I can see and hear, Chair. I'm here.
Thank you, Lisa. And we've got the the chief executive who promoted you, the executive director for the social care, Kerry.
Thank you, Chair. Thank you for the promotion. I can see and hear.
I'm sure the chief will be happy. And Nikki, our democratic service officer. Okay, thank you for that. We have got a number of apologies. Councillor Johal is not present. Councillor Kaur is substituting. Councillor Rasab, Councillor Coughlin and Councillor Cooper have given their apologies. Is there any further apologies, Nikki?
No more received, Chair.
Thank you. As like I said, substitution Councillor Kaur is substituting for Councillor Johal, and Councillor Keith Sears will be joining the membership to fill the vacancy of the committee, which is present. I'll move to item number 3, declarations of interest on any item from members. No. Okay, move on to item 4, local government access. This does not apply to the agenda. I move on to the minutes. There's a correction needs to be done. Nikki, Councillor Rasab said that he was present the last meeting and the minutes state he wasn't. So we need to correct that. Anybody else, anything with the minutes? Are they a true record? Are they accurate? The people that were present? Yeah, I'll move the minutes. Can I have a seconder? Councillor Gandham, thank you. Move on to item number 6. It's update on proposal for acute urology services at Walsall and Wolverhampton Trusts. And we've got David Loughton and colleagues to give us a presentation, and then members can ask questions. I'll hand it over to you, David, whenever you're ready.
Okay, thank you, Chairman. I mean, obviously, with the pandemic, we have had delays in implementing our proposals, and it will not now take place until the first quarter of the new financial year. So unfortunate, but that's where we're at. Happy to answer any questions, Chair.
Any questions? This is the sort of service of urology services going to New Cross from Walsall Manor Hospital. They supposed to. Sorry,
and also services moving from Wolverhampton to Walsall.
Yeah, so it's like a merger. Unfortunately, hasn't happened yet. David, my question, and members surely will think of some as well. Is it due to the pandemic, or it just other issues that have come up? Why has it not happened?
Well, it's complex issues in terms of the building work that is required to make it happen has been delayed, and as you're probably aware, we have issues with building materials. That's point one. But the other point is, you know, in terms of staffing and sickness generally caused by the pandemic, it's just not the right time to actually get on and implement it. I don't know whether Rosanna's on the call, if she wants to give any more detail.
Rosanne, would you please give us a further update on this matter? Sorry. Unfortunately, Rosanne is not on the call. So my further question is, I know these issues do happen and pandemic has affected that and building works. What's the plan? Is that going to affect any services to users? That's another question.
No,
also,
I mean, it won't affect services to users because we have been able to carry on. But obviously, you know, urology, the same as a number of other specialties, we are having to prioritise, particularly around the elective work. But I've got to say the good news in all of this is, you know, we have cancelled very little in the way of elective work in the first sort of 3 weeks of this year, which, to be quite honest, is a credit to everyone involved, because I certainly didn't expect to be in this position. And given probably another week or so, I think we will be, you know, in a better position than we are now. I mean, Walsall has done incredibly well in terms of managing it. We currently have about 80 inpatients with COVID. We just have to manage our way through it, Chair. And, you know, credit to everyone involved, and particularly in terms of delayed transfers of care in Walsall. Walsall's got probably one of the best records in the Midlands, and if not in the country, actually. It's been managed incredibly well. And, you know, I'd like to thank my colleagues in the council for the work that they have done.
thank you for that. You said, David, that going forward, the timetable changed. So you look at the next financial year. Do you reckon we'll be able to do that?
Yes, I believe we will. But I use that word carefully. I believe we will. But, you know, I don't know from a day-to-day basis how we will do with elective. I mean, we've really been lucky. We've only closed 2 theatres for a week at Walsall. And, you know, I was staring in the face a worse situation than that. Staff sickness levels are starting to come down. Walsall is currently running at 10.1%, but that is actually reducing now. And, you know, I need to get to nearer 6%. I mean, you would normally expect to be below 5%, but, you know, we're not there yet. And obviously with the change in terms of restrictions, isolation, etc., that is an improving situation.
Yeah, I'll come back if I have to. I've got council voters and council call.
I know that the Wolverhampton patients are actually, some of them are actually sent into Staffordshire for appointments. Will this still continue when Walsall and Wolverhampton join together? And will some of the patients from Staffordshire be transferred to Walsall Manor?
We obviously, in terms of Staffordshire, we use Cannock Chase Hospital extensively for elective work. And to be quite honest, that has been the saviour in the whole of the pandemic from a Wolverhampton point of view, that we've had basically an elective surgery centre at Cannock, which has no emergency medicine. So that is an advantage. We've transferred significant numbers of orthopaedic patients from Walsall to Cannock. And correct me if I get this wrong, but, you know, we haven't had any complaints about that, because you know, people are getting their elective surgery at Cannock, and it's working out really well, actually. And in fact, I have got plans. There are 2 wards at Cannock Hospital that have been used for other purposes, and I'm about to convert those back to wards. And then the intention is to push a lot of elective work through Cannock, because I don't need to remind people, the NHS is on track. There's currently 6 million on the waiting lists, and depending on who you talk to and who you rely on, waiting lists are going to climb and climb and climb. So we've got to get as much elective capacity, because obviously people who are waiting for hip operations and all manner of things. I mean, we've got patients waiting over a year, and in some specialties heading for nearer 2 years. So once we get the other side of the immediate pressures of the pandemic, we've got to pile on the pressure in terms of reducing elective waiting lists at both Wolverhampton and at Walsall.
Thank you, David. I've got Councillor Cole.
Thank you, Chair. Okay, so you mentioned earlier that the documentation and the paper trail that Walsall has been exceptional. Can you talk about what is it that Walsall have done in comparison to other boroughs, and how can we go about sharing this practice with others?
I think an awful lot of the advantage that Walsall has got has come from Walsall Together, which you have been working on for a number of years. And if I make a direct comparison with Wolverhampton, I think Walsall Together has really done marvels in terms of the position that you're in. Also couple that with Walsall, this is a double-edged sword, of course. Walsall has got a very good performance in terms of A&E and ambulance offloads, but that also creates its own problems because there are transfers from other areas to Walsall because of a good position in terms of ambulance offload times. So, I would really say you have benefited, and, I'm a newcomer to this. You've benefited for the investment and the working together in terms of Walsall Together in ways that other areas haven't done.
Councillor Cole.
Has that answered your question?
Yes, thank you ever so much. Another question is that 1.4, you talked about the supply chain difficulties that you've had, and the decision's been made that the trusts will delay the transfer of services. What reassurances have we got those transfers are going to actually happen at the timescales that you've given?
I can't give you any reassurance because I don't know where I'll be with staff sickness at any point in time. So I'm not able to give you that reassurance. All I can tell you is things are going in the right direction. Staff sickness is reducing. So, as I sit here today, I think we will deliver within the first quarter of the next financial year, but I cannot give you any guarantees. I also cannot give you any guarantees because at this point in time, as you're aware, NHS staff delivering frontline CQC regulated services have to be vaccinated by the 31st of March, but in real terms, that date is actually the 3rd of February that you've got to have had your first vaccination. And I cannot give you any guarantees because I don't know where we will be at come the 31st of March in terms of staff that at this point in time, according to the legislation, will have to be dismissed.
Yeah, Councillor Cole, absolutely.
Sorry. So you just mentioned about the vaccinations. Where are we on track to achieve the March date at the moment?
Sorry, can you repeat that? I can't hear you very well.
Sorry, you mentioned about the vaccinations. Are we on track to achieve the March date for that?
No, we're not. We're a long way away.
Okay. Any reason why?
I mean, sorry, can I just make the point here? This isn't an issue for Walsall, Wolverhampton. This is a national issue, right? The legislation went through and I have got significant numbers of staff that have not been vaccinated. And if we got to the point where those staff have to be dismissed, we will struggle to deliver a number of services.
Thank you.
Thank you, Councillor Court. Thank you, David. David, first of all, I just want to put on the record that we all members here and people in Walsall appreciate the hard work yourself, your staff, your colleagues and nurses are doing on the front line. And we understand the difficulties that COVID has brought on us and brought on your trusts where you are working. And we'd like to applaud yourself. We'd like to congratulate yourself, and we'd also like to put on record that we value this. I know there's issues there with regards to staff shortages and the take up of vaccines from members of staff. These are two big issues. And it's no fault of yourself or people who are unwell. And I think there's a shortage of staff generally national. There's a national problem with staff and nurses, and that's a government thing. And I think government hasn't been forthcoming in sorting that issue out of staff crisis, and the pandemic has made it worse. And I think now, as the deadline's looming in April, that all staff have to be vaccinated. It's not going to improve the situation. It's going to make the situation a lot worse. I've got a personal view on this. We shouldn't force people to have vaccines. We should encourage them. We should educate them. We should guide them, but it should not be forced. I think we are going to have a crisis in a couple of months' time. And I agree with you. It is a national issue, but we are where we are. So, yeah.
Chair, can I just say, you know, the legislation went through Parliament, and you know, all I can do is encourage people to take up the vaccination, and we are doing as much as we can to do that. But you know, this is a national issue. The one thing I will say is Walsall is in a much better position now than it was. We have recruited 260 nursing staff, and I dread to think what would have happened now if we hadn't done that, because Walsall used to rely too heavily on agency nurses, and you've now got agency nurses. Lisa Carroll, the Director of Nursing, is nodding her head, where you can book them and they don't even turn up. They don't actually turn up now. They'll just go to the highest bidder. So thank goodness we have recruited 260 nurses, and you know, that is, you know, where we're at. But obviously I can't get involved in the politics of this. The government made the decision, and all I can do is encourage staff. But I actually believe that after 21, 22 months, there will be a significant number of NHS staff who will refuse to have the vaccination, come what may, no matter how much encouragement I give. And that's the situation we are in. And it's obviously at some point in time, it becomes a political decision.
Thank you, David. David, I know you had a lot of sicknesses. Are most staff that were sick back, and are you back at full capacity now, and you've got the resources there?
Say again, I missed that, sorry.
Sorry, I said you had a lot of staff shortages due to the pandemic and people ill with COVID. Have you got your capacity and is it coming back in now? And is it back to what it was?
It's improving. Walsall peaked at 12% staff sickness. It's now down to 10.1%. But, you know, it needs to get nearer to 6% to make it copable from that point of view. But this also masks up Walsall Manor had got a significant problem in the way it managed long-term sickness. So before we got into this, it wasn't in a great place. And if I make a comparison to Wolverhampton, Wolverhampton's down at 6% and Walsall's at 10.1%. So some of it is masking up how long-term sickness has been managed so far, because within the numbers of sickness, roughly speaking, half of the staff, it's non-COVID sickness that we're working with. Half is COVID. But we are working our way through that. and I think we will improve that situation, but that is going to take a number of months to improve how long-term sickness is managed in Walsall.
Thank you.
Anything you want to add to that, Lisa?
No, I think you've covered it. It was the long-term sickness is definitely masking. We are currently addressing that now, but absolutely, we from a short-term COVID sickness, we did hit a peak over New Year. We are seeing our staff now returning, so it is feeling better on the wards.
Thank you. Before bringing Councillor Craddock, he's waiting very patient with his hands on his face. I will bring you in shortly. I know he's getting bored a little bit. My final question is urology services, the waiting list there, the pandemic, obviously the priority has been the vaccines and other sort of serious illnesses. Have you got a big waiting list in urology services in Walsall and Wolverhampton?
Yeah, we have, but I mean, again, this has been in the making for some considerable period of time. We had the 4th robot in the country 10 years ago. We've now taken delivery of the 3rd robot in Wolverhampton, and people choose to wait for robotic surgery as opposed to normal conventional surgery. And I happen to chair the West Midlands Cancer Alliance, and robotic surgery, we need a national strategy of how you roll it out, because certainly in urology, in gynecology, and now in thoracic surgery, robotic surgery is growing, and simply speaking, you cannot ever get to a place in, probably in the next 5-10 years where every decide exactly how we're going to manage that across the West Midlands. And my view is very clear. There will be 4 robotic centres to cover the 5.6 million population of the West Midlands. So this was a problem that was growing before we got into the pandemic. But I'm pleased to say, we've now got the 3rd robot. And obviously the results from robotic surgery are much, much better. But we keep expanding it, and the latest thing that we've expanded into is thoracic surgery. So the pressure's been there for some time.
Thank you, David. I'm going to bring Councillor Craddock in. Councillor Craddock.
Thank you, Chair. Just a couple of things, really. First of all, David recognising that Walsall Together has been a big factor in Walsall's success, really over or maintained improved position over other areas, and I think we need to recognise that, and the work that all of the partners in Walsall Together, and of course David, the trust there has been a big part of that too. So it's been a huge success for Walsall and for the patients locally and residents. The report, which we're talking about today, is an excellent move forward. It's consolidating resources and facilities in the right place to improve the outcomes for patients. So I welcome the report. And the final question, which is just a question for David, really, in terms, we've touched on vaccinations for hospital staff, which is a separate issue, really. But in terms of vaccinations across the general public, if the uptake of vaccines was better, how much difference would it make to you in terms of ICU beds and COVID patients within the hospital?
Yeah, I mean, I've got to say that in terms of the numbers at the present time, the situation, if you'd have asked me just before Christmas, I was feeling pretty down about things. I'm feeling okay now because, we're running at about 70, 80 COVID inpatients. We have got 5 in ITU, so the numbers are much, much lower than they've been in previous waves. So the whole situation is much more manageable than I thought it would be. And I heard today, in terms of the public, we are seeing circa 60 patients, 60 members of the public a day having their first vaccinations. So in fact, the public, to be quite honest, are doing a lot better than the NHS staff, because I'm not getting massive numbers of NHS staff coming forward for their first vaccination. So it seems the public in Walsall, you know, a lot are coming forward, and obviously we tend to see an increase of the public taking up vaccination at weekends. So I think the public are, if I'm honest, they're probably doing better than the NHS staff.
Can I just ask one supplemental question, Chair? There's a requirement now that you don't have to actually get a PCR test if you have a positive lateral flow test. That's going to drive numbers down simply because people won't be reporting COVID. How fearful of you are you that people will think the numbers are coming down significantly when in fact the infection is still quite high or very high in certain communities?
Okay, this may sound a bit daft, but I don't bother too much about what the community rate is. It doesn't really bother me what the community rate is. From a hospital point of view, all I'm interested in is how many COVID inpatients we've got and how many patients are in ITU, and sadly, how many patients actually lose their lives to COVID. So to a certain extent, I'm not that bothered, because on a daily basis, you know, I monitor the numbers of inpatients in both Wolverhampton and Walsall, and that's the thing that matters to me. You know, whatever the community transmission rate isn't that important in terms of managing the hospital service. And I must have got that right, because Lisa keeps nodding at me actually. So I know it doesn't sound right, and sometimes when your Director of Public Health comes up with what the community rate is, and I think that's the difference with the latest version actually. The community rate does not have the same impact on the hospital as previous waves have had. That was when I used to get really worried, when I used to hear the Director of Public Health tell me what the numbers were, and then all I did was compute in 2 weeks' time what we would get hit with. Right? And that doesn't appear to be happening in the same way, because if you look at the community rates in Walsall, you know, I'd probably have my head in my hands, but I haven't. So yeah.
Well, in Brown Hills a couple of weeks ago, it was 2,500, which was pretty shocking. We were worried when it was 24 or 25, but 2,500 was pretty extreme. But thank you, David. Thank you for your answer.
I hope you understand, Councillor Crowe, why all I can do is concentrate on what's actually happening on a daily basis. And the numbers in Walsall are starting to drop in terms of inpatients. Not massively, but it's starting to drop. And that's all I can say. Thank you, Councillor Crowe.
Thank you.
Thank you, David. Thank you very much. Any further questions from members? Are everybody happy? This is just a note. So are you everybody happy to note? Yeah, everyone in favour? Thank you. Just show hands. Thank you. David, thank you for that. I'm going to move on to item number 7. It's assurance report regarding Walsall Healthcare CQC inspection. I hand it to you, David, to present this, and then we can ask questions.
Right, I'll hand it straight on to Lisa, actually.
Thank you, David.
Delegation.
Thank you. So obviously you've seen the paper, so I'm not going to go through the paper in any detail. We had the inspection to medicine and long-term conditions in March 2021, and then the inspection for maternity services in July 2021. Since then, there were areas for improvement identified in both CQC reports, and obviously areas of good practice. We have action plans that are very detailed for both of those reports, with executive oversight, and I can confirm that a majority of actions are either complete or we are on track to complete them. Just to give you some of the headlines, some of the improvements we've made. I was appointed in August of 2021. We've had a new medical director, a new director of assurance as well, and CQC action plan has been a focus for all 3 of us, as well as for the rest of the executive board. As David's already said, we have recruited 260 nurses and 130 CSWs, and just for the council committee's information, we have 153 of those have been recruited from their international nurses, and we have supported to get them onto the register, and 123 of those have already got onto the register. We have invested in our environment. We've refurbished 4 wards. And we have a programme for the rest of this year and a real focus on our IPC arrangements. And we had an inspection of by NHS E&I around infection prevention control in December, and we've been rated as good from an infection prevention control perspective in all of our services. In that, they visited maternity and the medical wards as part of that visit. There's been a review of the governance processes across the trust, being led by a Director of Assurance. And from a maternity perspective, we've commenced a new triage system, which is nationally recognised, with fantastic feedback from patients that have experienced both the pre-system and the new system. We have spent a lot of time investing in our leadership as well, with the leadership development programme for our senior nurses. So I don't know if anybody's got any questions, anything they want to raise.
David, do you want to add anything, or are you happy with that?
No, I'm happy with that. I should have actually introduced Lisa. I'm sorry about that. You know, she's an excellent appointment, very experienced, and you know, credit there. I think the one thing that I would say, actually, and certainly I look to you as counsellors, any of the overseas nurses that you come across in the community, and we've had a lot of assistance from Walsall Housing to sort out accommodation. I think you've really got to bear in mind the infrastructure that we've had to put in for these nurses is quite unbelievable. You know, we have someone on call 24/7, that if they have a problem at 3 o'clock on a Sunday afternoon with their bank account, we've got someone that will sort it out. Because the bottom line is, a lot of these people, they didn't want to come to Walsall, they don't want to come to Wolverhampton, they didn't want to be in this country, full stop. And, you know, I spoke to someone the other day and said, you know, are you happy here? And he said, yeah, I'm happy. He said, you all looked after me, it's great. He said, but I miss my wife and children. Yeah. So you need to bear in mind that a lot of these people are here because they didn't have any choice. So we have to go the extra mile to make them welcome, and, you know, sort out a lot of other things as well. So it's going in the right direction. And I think we need to also remind ourselves as well that, you know, going back, and I've been in this job for too long, you know, I can go back 15, 20 years when we had a lot of nurses that came from the Philippines. They settled in this country. And I don't know what it's like in Walsall, but certainly in Wolverhampton, a number of my senior matrons, senior ward managers came into this country as staff nurses 15 years ago. So, you know, we can make it a good experience for everyone and give them something back. And then there will be another cohort, and I've certainly found this with clinical fellows, where clinical fellows, doctors, I've got over 300 on the programme. And at least half of them, you know, we know they are going to go back to their own country and develop the healthcare systems in those countries. So it's a win-win for everybody.
Thank you, David. Councillor Ditto.
Thank you. It's more of an observation than a question in regards to especially the maternity services. The fact that just gave me a bit of deja vu, because going back into 2016, when I first sat on this committee, the first report that came was about maternity services and services that were being delivered in Warsaw. And it's actually quite appalling to see that, you know, 4 years on, you know, still got those same issues being raised again in the inspection. I mean, what assurance have we got now that we won't fall again and go down and, you know, have to fail, well, require improvement again in the next inspection? Or, you know, there's concerns, because I know a lot of people who had personal concerns at that time in 2015-16 with the maternity services and the service they received, and one of them was that, you know, the staff were not able to care properly for those who were under their care at the time, and, you know, they were expecting them to do things that, you know, is quite difficult for them at the time, and there seemed to be no staff around to support them. And if they did ask for any support, nobody did come. So that, and to read that again is quite disappointing, really. and the fact that they were not able to control infection risks in a pandemic, were they indirectly responsible for causing people to feel as well? So what assurances have you got now that, you know, we've got the right measures in place, and that internally these points are being assessed regularly, and to ensure that we don't fall into that category again? Sorry, I'm not able to phrase this properly, but what I'm trying to say is, when you know, you've had an inspection or an observation, and I'm trying to see it from that point of view, you're given a list like we've given here. What are you going to internally do to ensure that you have your own assessments in place now, and make sure that, you know, these things don't happen again, and how will you manage that?
Okay, so we have a detailed programme of audit and internally now around our quality standards, with a new quality dashboard that's been nursing and midwifery metrics. These are audited, and they're not just done within the department, they're done by other people from our corporate nursing team and with peer review. These are reported through the divisional performance reviews and assessed through to our quality, patient experience and safety committee and through to trust board, so we have clear oversight. We have a director of midwifery that is now reports into me, but reports to board, directly to board, and attends and board, so has direct line to the board from a midwifery perspective. From a staffing perspective, we've revet all the establishments across the trust. We are recruiting, and we are monitoring our vacancies rates against our recruitment rates and our use of agency, because actually use of agency, when we're using agency staff, we are not assured that the quality is exactly the same as when it's our own substantive staff, and we are we are reducing. We were aiming for zero agency by January. The pandemic and the increase and Omicron with our staffing challenges has made that to slip slightly, but we have had to use agency during the last couple of months, but we are focusing on that on a monthly basis as well. So we have very clear oversight, we have visibility of our leaders, we have staff forums now as well, so staff can raise concerns. Drop-in sessions, access to execs as well as other members of the senior leadership team.
We also have a new leadership team in maternity, and the medical director at Walsall is an O&G consultant. So
that's true.
I think we've got real focus on there. The point that Lisa makes, I mean, it's a matter of public record. I don't like using agency staff. I haven't used any agency nurses in Wolverhampton since 2005, and I know I was unreasonable when I arrived in Walsall. I said by October we wouldn't be using any agency staff. I never really expected to get there, but you know, I want to get there as soon as possible, because it is just not good to be using high levels of agency staff. You've got no control over their quality standards. So, and Lisa and team, they are getting there, and particularly in maternity. So I'm confident. The one thing I do have to say, though, is across the country, and you've seen it with some very high profile failures of service, maternity services across the country are under real pressure.
Yep.
Thank you, David. Thank you, Lisa. I've got Councillor Cole wants to ask a question.
Thank you, Chair. You talked about, obviously reading the report, it's evident that there's a lot of training and skills gaps with individuals through governance and also leadership. What's been done to bridge that skills gap and bring everybody up to sort of standards?
Okay, so we have appointed 10 practice educator facilitators. They are nurses that focus purely on education but are in the clinical environment. So they have commenced in post. We appointed them before Christmas. They are now in post, and these are people that are working alongside nurses and midwives and AHPs to ensure to help them develop in practice. They're supporting our international nurses but our wider workforce as well. We are investing in education and training. We have a wonderful facility in the Manor Learning Centre, and we are utilising that and with our education team, and we are building our quality team, who are also working alongside our staff to develop, make sure they've got the knowledge and skills and competence to undertake their roles. So massive investment in education across the board, and within medical education as well.
Yeah, can I make the point on that? You know, when I look at what's happened with services in Walsall, I can backtrack an awful lot of the problems. Walsall Manor, I think 4 years ago, maybe 5 years ago, was put into special financial measures. And there is where the rot set in, I'm afraid, because training, development, all sorts of things was pared to the bone, and people were not getting the development that they needed. And we have significantly invested in training and development. I've merged the training and development functions between Walsall and Wolverhampton, and we're on the right track. But, you know, I think some of the quality issues at Walsall were a direct impact of the trust going into special financial measures, and things were pared back to the bone. So it's no one's fault, that's it. And that's discussions I've had with Ted Baker, the head of hospital inspection, that, you know, someone needs to really look at, when you put a trust into special financial measures, yeah, have a look at the quality of what happens there.
Thank you, David. You got a follow-up question?
No, I'm just going to say, you know, it's good to see that from where we were before to where we are now, you know, measures are being put in place and we're making improvements. And I think that's a testament to all the staff, you know, the cabinet members, the council that are actually doing the work to support that. Well done.
Thank you, Councillor Court. Yeah, thank you, David. David, I've got a couple of questions. First, of the initial inspection that happened on the 9th of March, the CQC gave 3 months to the trust to make significant improvements. And that was the section 29A notice that was. Are you satisfied, first of all, that all these things that were asked from CQC that have been done, and there's ongoing monitoring still that is happening that you have to do, and could you see a massive improvements from where we was and now, and what are the monitoring things that you are doing now and the concerns? That's my first question.
Lisa?
So from the section 29A, I'm assured that we have made the changes and submitted all our evidence to the CQC. They have come back that they are satisfied that they have that with the evidence that we've submitted. We have ongoing monitoring. We have part of that, the changes that we made to make the improvements for section 29A about ongoing audit and monitoring. That is monitored through the divisional performance reviews, through to our quality performance patient experience, the safety committee, and escalated up to trust board with exec oversight, and I'm the exec with responsibility for overseeing those actions and the ongoing monitoring of those actions.
Do you feel that the things that were wrong then, they've been corrected now? With obviously you made some a lot of improvements, whether it's staffing, whether it's working a different way, and there's obviously a different approach now. Are you satisfied? Are you comfortable that things are a lot better what they were? Because people in Walsall were really concerned when this report came out, and there was a sort of a they had an opinion that Manor Hospital is always in problems. Do you feel now we sorted things out?
There is a lot of improvement in what there is always work to do and always improvements to continue to be made with everything that we do. That's about quality improvement, but we are definitely in a different place to where we were when the CQC came in March 2021. The important thing for me is that the learning that we took from that, from the medicine and long-term conditions division, we've actually is not just been implemented within medicine, it's been implemented across the whole trust. It's important that we had that wider trust learning, so there were changes that were made across the whole of the trust with ongoing monitoring, and we continue on our quality improvement journey as we always strive to do things better.
I think the most important thing for quality improvement is recruitment.
Absolutely.
Yeah? You know, we've recruited 260 nurses. I must have recruited another 25 consultants since I've been in Walsall, and that is the improvement. Healthcare is delivered by people, and that was woefully inadequate in my opinion. So we are correcting that, but we've still got a bit of a journey to go to get the permanent recruitment.
Thank you for that. People are very important. Staffing is very important. What do you feel is wholly inadequate before then?
Say again, I missed that.
Either of yourself, Lisa or David, why do you feel it was wholly inadequate before?
I think I've already said it.
You've said it. Mm.
Right? You know, the trust was put into special financial measures 4 years ago, and regulators, they concentrated on balancing the books, and it didn't matter how you did it, you know. And it's not just Walsall, by the way. You know, I can look at Leicester, number of places where, you know, the same thing happened, and it was balance the books, and, you know, don't worry too much about the quality. I'm over-egging that, by the way. So that has been the big difference. And, you know, I'm not blaming the previous management in any way, shape or form. That was what was demanded at the time.
Do you think, I can ask this question, do you think funding was a core issue from central government with regard to staffing, and that was one of the reasons that it was underperforming?
No, I don't think it was central government necessarily. You know, it was the regulators. I mean, you know, until, quite honestly, until COVID came along 22 months ago, you know, the NHS, it was very fundamental that it had to balance its books. And so that's where some of the problems came in. And I've, you know, a number of people that I've spoken to in Walsall, I don't think anybody disagrees with me that finance was probably more important than the quality.
Thank you, Dave, for that. Coming back to maternity, we had the inspection 28 July, and I know it was just unarranged visit. It was a spot visit, and there's obviously it's quite concerning. Like my fellow colleagues have said, that there's been in maternity, they've mentioned environment, staffing, care and treatment, medicine, governance, leadership, several things they've said they got concerns of. Have we got obviously you will have a plan, and you will have a sort of a way to improve these things. How long has the Care Quality Commission given us to improve these things, and what are we doing about it?
So there is no time frame for improvement. There were no Section 29A requirements for the maternity, which gives you certain time frames. There is no time frame for improvement. Obviously, the CQC would expect to see improvement when they next come in, and that they wouldn't see the same things. From our perspective, we have a very detailed action plan. The actioning and the changes were commenced as soon as we got the verbal feedback on the day of the inspection. We have a detailed action plan. Many of those actions are now completed. All of them have executive oversight. Majority sit with either myself or the medical director, and some to oversee. They are reported again through the divisional performance reviews and through to our key president and trust board. I am confident that we are for a large proportion of those actions we already have made the changes, and we have the evidence and the ongoing monitoring of those changes. And there are and for all the other actions there is work ongoing with ongoing monitoring to get to where we need to be. Things, for example, the environment, there is some environmental work that is planned but hasn't actually taken place yet. But from an IPC perspective, we've made the changes, and we've had an external review from NHS England since then in December, and the maternity department was rated as good, with extremely positive feedback with sustained improvement they could see.
Now, the point that Lisa makes about the environment, we need to spend some considerable amounts of money on it, because I mean, I couldn't get my head around women in labour have to journey themselves halfway through the hospital, so we're going to have a complete separate entrance to maternity. I also need to get the midwifery-led unit, which was in the town centre, onto the hospital site, because the problem that you've got, once you have an isolated midwifery-led unit, the numbers of deliveries you can do just plummets. I mean, in Wolverhampton, we do about 1,300 deliveries through the midwifery-led unit, because you can afford to take real risk, because if something goes wrong, you just throw the doors open, 30 metres down the corridor, and you're into a consultant-led unit. So, you know, your threshold for risk is completely different than when you've got it isolated, and if something goes wrong, you have to dial 999 and get an ambulance. So that will make a big difference in terms of the service and the experience of women in Walsall.
Thank you, David. Thank you, Lisa. Just a final question, if I may, David, Lisa. On staffing, it says here the service did not have enough maternity staff to keep women safe from avoidable harm and to provide the right care and treatment. Have we addressed this with more staff and more better protocols? I know you've got more nurses, and it's brilliant. We applaud you for that, making these changes. On this measure, we got more staff in place in maternity in Walsall Manor Hospital.
Yes, we have recruited significantly to our midwifery workforce. Nationally, midwifery staffing is a challenge. I'm sure you'll have seen, I can't escape it on the media, but we have recruited. We are now almost fully established onto our delivery suite and fully established on our maternity ward. The vacancies currently sit in our community services, and we are recruiting to those. We're also looking at international recruitment as well, and some international nurses are arriving later on this year into our midwifery support. But we've attracted student midwives that have newly qualified. We've attracted some very experienced midwives from elsewhere as well, and we have a new deputy director of midwifery that's come from another hospital that's very experienced as well to support leadership in the department.
Sorry, can I just make a point here? I mean, this is not an issue for Walsall. This is a national issue, and as you'll be aware, Jeremy Hunt produced a report 2-3 weeks back, whatever it was, former Secretary of State. You know, the NHS as a whole has been woefully, not training enough doctors, nurses and midwives for a number of years. So this is going to take some time to fix nationally, but I think we're going in the right direction. But, you know, we do need, and I'm pleased to say, certainly from a nursing point of view, the nurses come through Wolverhampton University, and the Vice Chancellor and myself, we came up with the numbers that we needed to put in there. So, you know, we will get there, but it is a national issue. We haven't been training enough doctors, nurses or midwives for a number of years. And I think Jeremy Hunt's report is in the right direction.
Thank you, David. Thank you, Lisa. Councillor Pedley or Councillor Craddock, do you want to give any observation or any thoughts?
No, thanks, Chair. Apart from, again, echo your words for all the sterling work that people have done to improve the services. And it's always easy to go on a national picture and blame national governments that we've heard tonight. But we've got to remember we're talking about people over politics, and we need to look at care over criticism all the time. And actually, we're dealing about the people of our residents of Walsall being able to access those services in a timely manner, a professional manner, and all credit to those that are out there delivering those services at the moment.
Thank you.
Thank you. Agree with that.
You.
Yeah, thank you. Just on the record again, obviously it's our job as elected members to ask questions and scrutinise decision, and that's what we're there for. And decisions at the top or decisions at the bottom or whatever do affect people of Walsall. We are elected here to ask questions. Please don't take it in any wrong way. We appreciate your value the staff and in the hospital for all the sacrifices they made. We want the best for you. We want to help you. We want to be supportive for you in every way possible. And having these discussions in scrutiny panels are very, very important, where this relationship is to better people in Walsall, as well as helping you in the hospitals. So we are your supporters, and we are your people who want the best for the staff and the public in Walsall. So please, don't take any words, because look, we are politicians, but we also want the best for the residents of Walsall, and this is our job, to ask them difficult questions, to put these forward so we can improve things together as a family. So again, I want to thank NHS Walsall, the nurses, the doctors, and yourself for doing a very, very good job. Thank you very much.
Sorry, I don't take this as criticism in any way. I'm absolutely happy at being scrutinised.
Thank you very much. Any further questions from members? We've had a good discussion. Are everybody happy? Any recommendations for this report, or are you happy to be noted?
I think it'll be useful to have an update maybe later on in the year on how it's progressing. That'll be useful.
Yep.
I'm sure Dave and Lisa will be happy to come, just say in about 6 months' time.
Not
Yeah,
a
I'd be
problem.
more than happy to do that, Chairman. Chairman, do you mind if I disappear because I need to talk to the doctors in training in Walsall?
Absolutely. You carry on, David. Thank you for coming. Thank you for giving your time. Appreciate it.
Pleasure.
Thank you.
Yeah,
Thank
take care,
you.
all of you. Stay safe. Bye.
I'm going to move
Bye.
on to, thank you. I'm going to move on to item 8, it's area of focus. And we've got a couple of items. If members are happy for the next meeting to look at these. It's primary care access update. This was a really, really hot topic and a big issue in Walsall. We've had a couple of items of this in the last several months. And I recommend we have an update from the relevant people for the next meeting. And impact of resilient communities, that's been lingering for a while as well. And I think it'd be good for us to have a discussion on that and ask questions, relevant questions. So sort of I move that we look at these for the next meeting, and the next meeting would be in March. Would members be happy to support that? What is a focus? Nikki, would 2 items be sufficient for the next meeting? They're quite substantial, yeah. Yeah, I'm happy to move that. Is that seconded? Yeah. Yeah, that's fine. Brilliant. So we're done. Date of next meeting is the 3rd of March. That has been moved from the 1st of March. So please make a note in your diaries. That is Thursday, 3rd of March, not 1st of March. And then after that, our meeting will be on the 21st of April. Please make a note. So I declare end of meeting. Thank you.